I'm Dr. Rod Rohrich, board-certified plastic surgeon in Dallas, Texas. Welcome to Rohrich Knows Podcast, helping you become a better and more informed you. Today, let's talk about the new neuromodulator, the new Botox from Korea. And nobody better than to break it down for us than Dr. Steve Fagien, a world expert oculoplastic surgeon and an expert in neuromodulators. Steve, welcome. How are you?
Oh, I'm doing great. Happy to be here with you always. Welcome to be back. Happy.
Great. And look, of course, he's actually, of course, in Boca Raton, that beautiful background there. It's where we all want to be. So, all right, let's break it down. So, there are a lot of neuromodulators out there in the U.S. today, and a new one just got approved. So tell us about this new Korean Botox. It's actually probably, I think, the number one Botox or neuromodulator in Korea, is it not?
That's correct. Letybo is the trade name. And they went through the FDA trials like they all do on the glabella. And it was actually a placebo versus drug study. Mm-hmm. So obviously it showed that it worked very well. And remember, with FDA trials, you just have to show that it's safe and that it's effective. It works and nobody gets hurt. And it passed, like all the neuromodulators when they go through an appropriate study. And again, the study was done only in the glabella, which most of these studies start out being, and then everybody wants approvals in other areas. So it did very well, obviously, and you would expect it would. And for one good reason. Most of the neuromodulators kind of do the same thing.
Right.
Now, they have their personalities, which make them unique. But generally speaking, this drug, just like all the other drugs, the other Korean drugs as well, work very well, particularly in the glabella. And now we just got another one to choose in our practice for our patients.
So how does it work? I've not used it yet in the U.S., but as I understand it, it was a clinical trial that actually didn't compare it to a neuromodulator.
Correct.
And that it was rapid onset, more like Dysport. But what about the longevity of it? Because I know it's the number one neuromodulator in Korea, but also I think it's more cost effective, correct?
Yeah, I mean, those are very good points. And the things that practitioners and patients look at, how long does it last?
Right.
How much is it going to cost me? And even on an annual basis. So again, when you do a glabella study only, and as you appropriately said, this was a placebo, which is basically saline, versus drug, it's going to perform well. And then when you treat just one area, you can be somewhat deceived by, will that work the same in all areas of the face? So these drugs seem to work, especially in the glabella, because most injectors inject at least similarly in the glabella. They get comparable results. So when somebody says there's some superiority in how long it lasts, we need to see in other areas of the face and other doses if that's actually true. Because most neuromodulators, the active ingredient is the same. Certainly in the botulinum toxin type A, which is Botox, Dysport, Xeomin, Jeuveau, and the many to come. So I think what's interesting about neurotoxins is once the drug, the protein, gets to the muscle, which is the target, then it works. How it gets to the target, how long it takes to get to the target, and if there's some diminution of effect by the time it gets to the target, will oftentimes dictate how long the product will last, because most of the longevity relates to dosing.
Right.
So when you give somebody a large dose, and the Carruthers proved this years ago, that if you gave Botox Cosmetic 80 units to the glabella, which is a huge dose, that's basically 80% of the entire vial, it'll last a year. So dosing is really important. And the problem is when you increase dosing, you increase the chance of having side effects and it going to unwanted areas. So there's a balance between dosing for maximal aesthetic effect, safety, and how long the drug will last.
Good. So how does this compare to the, obviously the market leader is Botox, whether you like it or not, it's Botox because they have the most science, the most use in this country, well over 20 years. Is the area of dispersion or the width of it as similar to Botox, and then the longevity,
Yes, so exactly what you're saying, the field of effect Whereas when you inject in a particular point, how distant from that point does the drug work
Right.
varies in all these drugs. Now, we don't have enough experience with Letybo to see what that field of effect is. But my guess is, being like much of the other neurotoxins, it's going to be somewhere between Jeuveau and Botox Cosmetic. Now, that doesn't mean it's any better or worse. It means what you need to do is know your drug, know your patient, understand what they want out of the drug, understand how the drug works, and as we get more experience with this drug, we'll learn about the field of effect, and then give the appropriate amount of drug to a particular area. The other thing that leads into field of effect is how much you reconstitute it. Some people remember these drugs, most of them, except the new ready-to-use drugs, come in a powder, essentially, and you add saline to make it injectable.
Right.
And how much saline you add, people used to say didn't matter, but it turns out it does.
It does.
And how you reconstitute a drug definitely affects that field of effect, because if you add a large volume, it's obviously going to spread further.
Right.
If you have very, very small volumes, the mechanical dispersion, if you will be limited. So there's so many moving parts to how it's basically the art of doing neuromodulators. And that's why it's so important to see somebody who's very experienced with neuromodulators. And I think, honestly, in my opinion, it needs to be someone board certified in whatever specialty they are, who has a lot of experience with neuromodulators and different neuromodulators.
Right. And it's the new kid on the block. We've had several, we've had Doxify, Xenamin, Dysport, everything else, Jeuveau. And you're right, you have to understand the intricacies of each of these neuromodulators. And that's why you need to go to an expert injector, because, I love Botox in the glabellar. I love, Dysport in the crow's feet, because it really lasts longer, and dispersion is, area field is much better there. And of course, Jeuveau is fantastic in the area where you really need to be specific on the lower face. So I think you have to know your filler, and you have to know your neuromodulator well. And I think time will tell. I mean, obviously it's the #1 neuromodulator in Korea, but I think time will tell, don't you think, whether it's going to be so in the United States?
The problem with #1 in any area, there are a lot of factors that influence that. So particularly when it's made in Korea, my guess the cost to the consumer, the injector, is a little less.
Exactly.
So cost is going to influence use. And cheaper isn't always better. But again, as I mentioned, you can make most of these neuromodulators work pretty close to similar to the other one, the competitor. So cost becomes a factor, because not only is it potentially less expensive for the patient, but it can be, frankly, more profitable to the injector if they're a good injector.
Right. So what are 3 take-home points for the viewer and for someone who's looking at this podcast and saying, okay, should I try this or should I not? Or tell me what are the 3 things that the viewer or the potential patient should understand before they kind of take this leap?
Good question. First of all, when any injector is trying a new neuromodulator, they should start slow.
Right.
In fact, again, this is only FDA approved for the glabella, Letybo. So my thoughts always have been, it works well in the glabella, definitely start in the glabella. That doesn't mean you can't try it in other areas, of course. And most of us used Botox Cosmetic in all areas of the face years before they were FDA approved for those areas. But start slow. Understand that it's going to be similar but not identical. It will have its own personality. And don't be surprised if the areas outside the glabella, the crow's feet, the forehead, don't get the same longevity or response that they did in the glabella, because our injection techniques in those areas can be very different. So I think start slow. I think it's good to try a new drug, certainly if it's been approved. We've proven it's safe and effective. And then you make your own decision based on will you use that in your practice. And I've learned a lot about older neurotoxins that have been here by using the new one. I actually see the nuances of that and realize, well, you know what? I think using this one, you can get a better response, a better aesthetic effect using this technique. So that's certainly one. Start slow. Number 2, ask your provider, whoever that may be, have they had experience with this?
Right.
My daughter actually saw an injector, and she walked into the office, and they said, "We've got this brand new drug, and we think you should try it." It was a neuromodulator. And my daughter astutely said, "Well, how many patients have you treated?" And the answer was, "We just got it."
Oh my God.
So her response is, "You know what? I think I'll use the one I used last time." So,
Yes.
so it's not an unreasonable question to ask whoever that person may be, is how much experience do you have? And what is different about this drug in your experience, if you have experience, that would make me want to use this versus the one I've been using for many years and having good results? The other thing is, sometimes you'll get some tachyphylaxis or lack of response from a neuromodulator in patients. And the patients believe they're getting immune to it, which they typically aren't. But sometimes when you change to another drug, they go, I think it worked better. Or it didn't work as well, and they go, I want to go back to the other one. I think the first one lasted better. So those are the things you want to ask. You want what kind of experience? What's your game plan here? You and I have had this conversation. I don't charge by the unit. And I find charging by the unit, we're better than that. Absolutely. When you charge by the unit, we're not selling product, we're selling results. We're giving results that patients are satisfied with, and more than satisfied, thrilled with. And a good injector, frankly, can use less drug and get a great result with less problems.
I agree. Wise words from an amazing injector and an amazing surgeon, unbelievable, Dr. Fagien. That's right. Know before you go. Find an experienced, honest, and ethical injector. Somebody who really, really cares about you and your outcome. That's so important. So give us your thoughts, give us your comments, and thanks again, Steve, for amazing advice. And I think this is really the take home. Find somebody who's going to be open and honest with you about what works and doesn't work. Thank you. Until next time, stay safe, stay informed.